You're watching the Wellness Hour, news that makes you healthier. I'm Randy Araz. Today's topic, extreme smile makeovers. According to my first guest, he says that your teeth and gums are never too bad to have the smile you've always wanted. There's always something that could be done. He is Tennessee's go-to dentist when you want a beautiful smile. With us, we have Dr. Araz Amedy. Dr. Amedy, welcome to the program.
Thank you for having me, Randy.
Now, for people that don't know your practice, like who's the typical patient that you see?
So there's really 4 different types of patients that we see. The first patient, we're talking about people that have had some bad experiences with a dentist. They've had bad teeth. They've got discoloration of their teeth, broken down teeth, wear and tear on them, maybe some gaps, spaces, and they're in a situation where when they wake up in the morning and they look in the mirror, what do they see? They see somebody that's not really their full potential. They go around their days hiding their smile.
Do they really?
Yeah, oftentimes.
Do they tell you this?
You can see it. When they speak, sometimes they cover their mouth.
Okay.
And so these are things that they want to change about themselves. They just don't know if it's for them. They have discoloration of their teeth. They've got broken down teeth. They may be missing some teeth. There's wear and tear, overlapping of the teeth, spaces, gaps that they're not happy with. And this is not a simple fix. We're talking about major full mouth reconstruction. We're talking about bad teeth that need a full makeover. So that's who we see as our first patient. The second patient, Randy, it's the gum disease, the bleeding gums, bad odor in their mouth, bad taste. And they're at a point where they're fighting these bacterial infections that they can't seem to get rid of. And they're trying everything they can. They're having trouble with this. And so the foundations around the teeth are the problem. So these are the kind of people that we can bring them in. We can clean everything up. We get rid of all the bad, the infections, the bad bacteria, so that they can be happy. They don't have to be concerned. Is the person that they're speaking with able to smell the bad breath?
So how soon does the bad breath go away?
It can happen immediately as soon as we get them treated. It's a matter of just getting everything that's presently causing these problems cleaned up. Get them that new, beautiful smile that they deserve to be proud of smiling and be able to talk confidently. So then we've got our third type of patient. That third type of patient is the person that feels like they've done everything they can to make their smile beautiful. They go to the dentist, they're going to their cleaning appointments, but what they find out is every time they go in, every 3 to 4 months, they're going in for a deep cleaning. They're getting this cavity filled and that crown done and this root canal, and that root canal fails. And so they spend time in the dental office. Every year they're taking multiple trips, time off of work. Basically, we have two weeks of vacation on average for most people. And they don't want to spend that time at the dental office. They want to go on vacation. That's why it's called vacation. Nobody likes going to the dentist,
Exactly. Do you hear that? Do they say, hey, no offense, Doc?
All the time. Do
you have a funny one-liner? Because I heard you're funny from your wife, who's also a dentist here in the studio.
We'll get to that. I've got some for you. But we've got these people that are just wanting a solution and something quick. They want it done, a rapid, full mouth reconstruction, something that we can get cleaned up right away, and we do that. So then you've got the fourth patient. Who is that? That's the person that is the opposite. They don't go to the dentist. There's a reason. They haven't been to the dentist for years. And
you said like 15, 20 years sometimes.
Exactly, and sometimes longer than that. Sometimes when you're 30, sometimes I've had a guy come in that said, I haven't been to the dentist since I was 6 years old. Why? Because it started with a bad experience for him. Okay? So these people have a dental phobia. They're scared. They're afraid to be in that dental chair. I walked in on a patient, new patient, first time meeting him. He's sitting in my chair in the corner. His arms crossed like this. And he said, Doc, I'm sorry, I know I'm in your chair, but there's no way I'm getting in that chair. Not until you speak with me. And so we sit down and I sat in the dental chair and he's sitting across from me. That's good. And we're looking at each other, and Randy, I could see the nerves. I could see the anxiety. This is years of, they wanted take care of them. They want their teeth to be. They've been trying everything to take care of it at home. But you know what's happened?
What?
Pain. Pain has caught up with them. They can, you can only avoid some of the problems for so long. And sometimes it's a slow process. It happens over time. You know, it's one of those things where you know there's something wrong. You know you've got to do something about it, but they don't want to come in yet.
So they get to the point where like they can't take the pain, so now they finally come
Exactly. And then there's the other patient that the pain is out of nowhere. It's right before your son's graduation or your daughter's birthday party.
Okay.
An event that should be a special moment to you. And you don't get to enjoy it because of that problem. And so these are people that we sit down and we speak to them. I want them to know who I am. I want them to know I'm a person, just like you. And that, yes, I'm a dentist, but you know, I'm trying to help you here. And there is a way to do that. There's a way that we can address all those concerns without making you feel like this is the worst place in the world. This is, matter of fact, best thing I like to hear. And my assistants, they work alongside me. We have such a great relation because they sit there and the patient will say, so doc, when are we gonna get started? And I say, well, we're done. Well, that's it. You're
because
done.
of what? Sedation?
It's a variety. Some of these people are even not without sedation. This is without sedation. This is with sedation. Now, the sedation helps. A lot of times they don't even remember they were at the dental office.
Okay.
You know? And then you've got the patient that is not even sedated. You know, they come in.
They're just numbed up.
They're numbed up, and they tell you, what's going on? Are we going to get started? I mean, we're already done. We're getting the wheelchair. We're going to roll you out. And so it's a special moment to see these people that have struggled for so long, because dental phobia is a real thing, and it's been around for a long time. You know, if you look at the surveys out there, some of the biggest fears people have, it's dental fear. Just the fear, they don't even like to talk about.
So at the beginning of the show, I said that you said that your teeth and gums are never too bad to have the smile you've always wanted. Is that, you believe that?
Absolutely.
You see that?
Absolutely, all the time. I mean, I'll give you an example. Look at this one right here.
Okay.
Just look at that for a second. We've got Miss Sherry. She comes in, gummy smile, short teeth, some discoloration, some broken fractures, and she's just looking for options. She didn't know what she wanted, but she's like, Doc, what do you think? What can we do? And we looked at it and we went over a few options with her. What we decided is, I looked at her, I got excited.
Okay.
I was like, and this is what I look forward to, Randy. I look and I say, you're gonna like this. You're gonna be happy with this. Let's do this.
Like, you can see the end result when you're talking?
I mean, when you do this enough, Randy, you can see the same problems and same issues. And now everybody's a little bit different, but we have an in-house lab to custom fabricate.
So what'd you do for it?
We were able to, if you look at these pictures, look at the smile line, gummy smile, right? We wanted to make the teeth look bigger, a little bit nicer, wider, something that when she smiles, it still looks really nice and natural, right? So we were able to, if you look at that picture and then
some before and after.
Exactly. We were able to look and look at the glow in her face.
Okay, she has a glow.
She looks a little bit younger, doesn't she?
She does.
You know, and so this is something, it was done in the same day. She came in the morning, and at the end of the day, that's what it looked like. And she was smiling. You could see the confidence. She loved it, and she's such a sweet person. This person here, Miss Sherry, she is a joy in the room. She's always laughing and giggling. So to give her the ability to smile like that and to be proud of it, that's what we do. So let me show you this next patient here. This is Michael. Now Michael, he actually came in after his dad came to see us. His dad came to see us, got his smile done, and very happy with it. We see this often.
Well, that's got to be unusual when I'm looking at this before.
Look at that before, yeah. So that's not unusual.
Really?
That is something we see every single day, and we see a lot worse. We see some things that people are afraid to tell us or come into our office and show us, because they even give me a warning ahead of time. Doc, they give me a whole story of this is what I've gone through, because
so they just
want
don't
to explain.
So they never smile. So guys like me don't see this.
Exactly, and they're hiding it. Whether it's growing out their facial hair to kind of be longer, or I've had some people say during the COVID pandemic that they were happy to wear a mask so that they didn't have to worry about smiling.
Interesting. Okay.
And so these things are real concerns that people have, and they come in, and we take that guy, a young guy, and we give him the ability to feel young.
Looks good. Looks good. I gotta admit, yeah, sure.
Yeah. So this is what we can do. This is the smile, the beautiful smile that we're trying to get people to understand. This is what you can do for yourself so that you can show your personality, show who you are. I mean, be able to, you can land a better job doing this, you know?
Why the better job?
Well, confidence.
Okay, good point.
You take this guy and that guy, and they both go to an interview. Which one?
Well, one looks a little bit more sophisticated.
Right.
Maybe even educated.
Exactly.
He's even more handsome, because you told me that on the phone, that it adds to your whole look.
And you know what's the beauty of this, Randy? We look at this guy. He comes in, and initially he's very, shy, kind of reserved a little bit. Nice guy, but he's kind of a little bit more quiet. And then we see him come in later, and he's more talkative. He's more friendly. He's, it's little differences, but you notice this. And a lot of that comes with, first, they've got comfortable with you now. They've worked with you. The fear that they had when they first came in, it's out the window. They don't even think about it anymore. And then there's the after effect, the fact that they're able to smile and be happy.
So you did like a combination procedures. Sometimes, like if they're missing just one or two teeth, you'll do dental implants. Mm-hmm. Or you'll do...
Yeah. So we do a combination. Sometimes it's crowns, sometimes it's bridges, sometimes it's using implants to replace missing teeth. Oftentimes we have to build bone back. When you lose teeth, you can lose the bone around them. And these problems can get a lot worse relatively quick.
What does this guy say? Like when he looks at the mirror and sees, because that is a big transformation. What happens?
With any of these transformations we do, what we notice right away is, why didn't I do this sooner?
Really?
Yeah. I mean, one of my favorite patients here, Mr. Henry. Look at that, Randy. We had Mr. Henry come in. He's got 5 implants on the top with single teeth crowns on them. And then he's got 2 implants on the bottom, right down there. And so he's got all these other teeth that were broken and missing. And so he came in and he said, "Doc, I've been to an oral surgeon. I've heard about different things. And, I know they do the surgery, but I still need to find a guy to do the prosthetic phase of this. What can we do?" And I said, "Well, we can do everything here if you'd like. We can do everything here." And once he got started talking, he got excited, I could tell. And you know what he told me? He said, after we were done, I mean, look at that after. He's got teeth now.
Okay.
He was looking for functionality. And he left.
What does that mean?
So he was looking for the ability to eat some of the foods that he's been missing out on for so many years. I mean, he goes to restaurants. We all go to restaurants, right? We look at a menu, and you're always picking out the food you want to eat, right?
That's right.
Yeah. Well, some people, they don't have that option. They're looking at the menu and saying, "What can I eat?"
Is that right?
Yeah. And so he got that back. He got the ability to eat what he likes to eat. And then he also got a beautiful smile with it.
Looks good.
Something that, he's feels a lot better when he looks in the mirror. And I spoke to him actually before I came in here, because I wanted to see if he'd let me use his photos. I really liked his case. And he said, "Doc, what you did for me," he said, "I was missing teeth. I had all these issues for years, and I was putting it off, and I'm happier than a child with a candy bar. This is special for me." And so it's cases like this that really bring joy to our field.
But you're a dentist, right? You probably think the smile's like the most important thing. How important is it in your mind?
Randy, it's not because I'm a dentist. Look, dentists are not. When you look at somebody, the first thing you notice their eyes, you notice their smile.
Okay.
Why? Because 95% of our body's covered in clothing. And so naturally, we notice their smile, their happy face.
All right.
Right? So when you're looking, think about somebody that is a loved one that you've lost, right? Close your eyes, imagine that person. What do you think of? You think of them as a happy person. You think of when they were smiling, when they were, happy and friendly.
That's a good point.
And so, these are things that we notice. A smile brings out confidence. When you've got a beautiful smile and you're looking in the mirror, it brings out your inner smile in you.
The charisma.
Exactly. Good. Charisma. Exactly. Think about the word charisma. Well, how do we define charisma? You can't, if you close your eyes and think of someone that's charismatic, what do you think of?
Yeah, the smiling and the talking and
exactly.
Maybe waving their hands around or something.
Absolutely. And so, we can go into, think about Hollywood, right?
Yeah.
These directors, they know what they're doing. when they cast these roles, they know who's the good guy and the bad guy, the villain and the hero,
Okay.
right? And so what do you see? You see the bad guy, the guy that they always make their teeth look gray and their teeth are overlapped or missing, or and it's to portray dirty or filthy or from the street or from these people that come to see me. They aren't bad people. It's unfair. It's really unfair because I see them. They come in with gum disease and bleeding gums and these issues, and they've been trying, but they're not bad people. But we see it in the movies. We see that they portray this. There's dentists out there in Hollywood that they hire to bring them to make the teeth look bad.
They make bad teeth.
And then the hero, what do they look like?
Good teeth.
They look perfect. They want
So
them
we're
to
like
be,
associating bad
exactly.
teeth with
They wanna
poverty or whatever,
Right.
because we're being conditioned possibly.
Absolutely. They want you to be attracted to the
that's
hero,
a good
the good person. And so, these are things that not the everyday person thinks about, but this is in our society. We live in a world of Instagram and Facebook where everybody's posting a picture. And what we see a lot of times is these people, once we do their smile makeover, their Facebook starts to blow up.
They're doing selfies.
Everywhere, and to the point where it's, people are unfollowing them or unfriending them because they feel like
Too much selfies, too many selfies.
But it's a good thing. It's a good thing that they're able to finally be that person, that their full
That's good.
potential. Absolutely.
That's nice. And you get to see these transformations, as you say, every single day in your
Oh
practice.
yeah, absolutely.
Because you kind of like, with you, it's not like the, just the cavities. You're doing people come to you with really bad teeth.
Yep.
And a lot of them, you say, they feel like they're going to end up losing all their teeth.
Exactly, and they're afraid of dentures. They don't want a denture. They've thought about their grandfather or maybe their father, and so they don't want to be in that position where they're going to have a traditional denture. They don't want to be using denture adhesives and that guck in between their denture that they have to taste, and it covers up the taste buds in the mouth. So, look at this, Mr. Robert here.
Okay.
He came in. I had to force his lips up to get his teeth to show.
Because he just didn't want to smile.
He didn't want to smile. So he came in and he said, I don't want teeth that I have to worry about. I want a beautiful smile, and I really just care about being able to eat a ribeye. I love, and this guy, he's a special guy. He drives around the country in his huge mobile home, and he's going to these parks, and it's him and his wife, and they're enjoying their retirement years, and he doesn't want to be limited to what he can eat. He doesn't want to be thinking about it, and so we were able to create
just a couple of appointments.
Literally 2 appointments. He came in. Now that's to get the prototype in, right? And we were able to work with him and design the smile, because every person's different. A man is different from a woman in the way that you shape their teeth. And so when we have this in-house lab, we are able to work with them and see exactly how can we make this you, the best version of you. That's what we do. This next patient here, broken down teeth, cavities, a lot of the same stuff that we see every day, right? Missing teeth, he's looking for a solution. He wants a one-time fix. How can we do this? And so we give him that beautiful smile. If you look at his after photos, look at that.
Looks good.
Yeah, so great example of what we do every day. This is not a once a week thing. This is multiple times a day.
It's like a combination of stuff you're doing.
Oh, absolutely. We've got a combination of crowns, bridges. So what we did for him is we were able to choose a cosmetic denture as his treatment option.
Okay.
He wanted something that got rid of all the bad problems, the pain, the infection, the gum disease, the bleeding gum. And so that was his fix. Now we may end up doing implants on him. We may be able to do certain things that can make this a whole lot better.
But that's a good looking cosmetic denture
Absolutely,
right there.
yeah. And
I think anybody would agree with that.
And that's an immediately fabricated denture too.
Do they fit better than before? Like some of the newer dentures?
Oh, absolutely. We take these impressions. We make this all custom made to their mouth.
Okay.
Their bite, how their jaw relationship is. Sometimes people come in with, cross teeth. They've got cross bite, meaning their jaw wasn't, when they were born, it grew into a position that it wasn't really supposed to be in. We can fix that.
Okay.
We have these patients. I actually have a patient here.
Okay. Now we are short on time, and I know you still have a stack of those photos, so we probably only have about 2 minutes left.
Just a few more photos, okay?
You got it.
All right, so this one here, what we were just talking about, some of the teeth were in cross bite. They were worn down.
That's bad teeth.
Yeah, they were basically flat. And you see the yellow color, the intrinsic staining there. we did a full mouth of crowns on the top there, and then the bottom as well. We get the anterior zone, and he's able to now be proud again to smile. He shows his personality to us.
Well, you know, we talked in the green room, and you said that most of these people hated their teeth for 10 or 15 years. Like they missed out, as you say, on a lot of good years. Like this is a guy that probably waited and put it off. And
they're busy working. They're spending all their time, you know, building this future. They don't think, you know, this is the time to do it until it hits them at once, and they say, you know what, this is it. And I want everybody that's watching this show to think about that. You know, you can keep delaying this, but there's going to be a time where some of these problems catch up with you. You can be proactive about it and stay ahead of it.
And a lot of these people are in their 70s and 80s are getting this stuff.
Oh, yeah.
These full mouth disasters.
Absolutely.
You give them a nice smile.
Yeah, we're talking about, you know, there's no age limit. We see people as early as in their early 20s, and we see people in their 90s. You know?
Is that right? Okay.
Yeah. Here's another
I'll
case.
rush you a little bit, but this is good. Wow.
Yeah. She came in with a broken bridge. Things were falling apart. Removed that bridge, got things cleaned up. She went home with a beautiful smile. Now, she got a little bit unlucky with the COVID situation and had to work around that, but we were able to still finish her up, and she left very happy, and she wanted me to send this message out to people.
That's nice.
Absolutely. This young lady, she owns her own business. She's very busy. When she comes to my clinic, she's looking at her schedule and calling this person and that person. And I'm thinking, okay, we got to get you taken care of. Let's see what we can do. Well, look at that after. Missing, now a lot of people, they don't know. When you smile, a lot of people have their front teeth. They're missing their back teeth. They don't have the back teeth. And you don't think there's an issue because that's our aesthetic zone, right? But she can't chew without teeth in the back. These front teeth are meant for cutting food, not grinding it. And so we're able to give her a full smile, something that's beautiful and fully functional to eat the foods that she deserves to eat. This one here, missing all the front teeth. What do you think, Randy?
Well, it doesn't look good.
Well, look at that after then. Who's that young man, right?
Very nice. Different guy.
Another one. Mouth full of cavities, broken down teeth. We've got, I mean, this is our everyday, like I said. This is something that we can change people's smile in that same day.
Now, we should mention you're a general dentist, and I know there's no such thing as a super specialist, but that's kind of like the new trend where the doctors are starting to do their own root canals, they're starting to do their own cosmetic dentistry, taking care of the gums. Is that kind of like your center, like where
we do it all? We get people in here and we tell them all the different options. You know, for some people, there's one option that works better than the other. It's their decision. We want them to be informed. We show them all the models that we can. We have all the technology to look at this and design this custom for them, and so they are able to leave with what they want, not what necessarily has to be done.
Okay.
Yeah. So here's another one here.
All right.
Missing teeth, came in, very aesthetic, beautiful denture for her. So, and this one here, we're right after the appointment, we're still kind of learning how to smile. We don't even have the ability to fully, because they've been hiding it for so long, it takes some time. All right, this one right here, again, changed this man's life. He is proud to smile again there. Randy, I've got the next patient here.
Do they come in skeptical, by the way? Like they say, Doc, this is the worst you've ever seen,
You know, they come in and you can read a lot from without them even saying anything. Now, sometimes they do. They say, I'm sorry for what you're going to see. Or, I tried to brush before I came in. But we know that they're here for a reason. They're here to better their life.
Good.
This next patient, Randy, someone very special to me. That's my mom. My mom was was missing a front tooth. And she was wearing a little flipper. I would see it right by the sink every day, right? It wasn't until I was able to convince her to come in. She's scared, very nervous, like many of my other patients. She didn't want to get numbed up. I said, I'm your son.
Okay.
I convinced her to come in. And look at that before. I had to kind of force her to show her missing tooth. And then look at that after. She's smiling so big now. And now she doesn't have to worry, did I forget my partial anywhere? Am I missing it? These are things that so many people lose their prosthetic. They lose their partial dentures.
So what do you do for her? Like exactly, what is that?
If she had gone to any other dentist, which, she first did, and she got a little flipper for it, or removable, right? Well, she could have gone anywhere and gotten a bridge. They would have shaved down the teeth, good healthy teeth that she's got, and shaved them down to little nubs, and then now you're in a situation where that bridge can fail and you're out of options, right?
Okay.
Well, with the single tooth implant, we were able to, and she was told that she didn't have enough bone. I looked at her CT scan, I said, who told you this? I looked at that and I said, why are they telling you that? Let's fix this. We put an implant, we didn't even have to graft. Now, sometimes we graft bone to build that bone back if they're missing it. This one, we didn't even have to do that. We put the implant in there. She was able to get the tooth screwed down right then and there. And so here she is.
What about pain? I mean, I know everybody has a little bit of pain, but is this something they complain about? Because it seems painful.
Very minor soreness. I mean, it's nothing that prevents people from doing this. This is, the outcomes are so special that minor 1 day of soreness in the gums, it doesn't even bother them.
And you're big on sedation.
Oh,
so
yeah.
Numbing and, of course, sedation.
Oh, absolutely. And so that sedation, I mean, we get patients that don't remember that they came to the dental office. They call us and say, hey, I think I missed my appointment.
Come on.
And I'm not
Really?
kidding you. Yeah. And so there's a way to make the most anxious person feel relaxed. And so that's how we address that.
How long did you work on your mother as far as trying to talk her into it before she actually did it? Like a year?
The first thing is she just didn't believe it could be done.
See, that's your own mother. You can imagine the public.
Right. And I said, Mom, I do this on my patients every day. And she said, okay, well, I'll come in for x-rays. Let's get some x-rays.
Okay.
And when I looked, and I took her in the room, and we showed her the computer, and we showed her, this is how I'm going to plan the implant. This is where your bone is. I custom fit the implant to the size, the length, the width, and where I'm going to place it so I can make sure that everything is aesthetic, and there's no way to tell that it's not a real tooth. And it looks so good.
And she can eat better. Everything's good.
Absolutely.
Okay, we're out of time. Somebody watching this, their mouth, like you said, they haven't been to the dentist in 20 years, 15 years, bat off. But they've heard what you had to say, but they're still skeptical or scared, or the last thing they want to do is go to a dentist. What do you say to them? But they don't like their teeth.
I say, come in and see us. Come meet us. Come in for a free consultation. We bring you in. We'll show you what we do. You'll meet the team. We'll do some diagnostic imaging and talk about options. Let's just talk first.
Okay.
And see, it may be the best decision they've made in their life. We don't know until we see them. So we invite them. We say, come and visit us. Come into our clinic. We'll treat you like the person you deserve to be treated.
And you have fun at your office.
Oh, yeah, absolutely.
You're considered funny because you have a sense of humor about things.
I'm a young guy, Randy. I'm not going to be too serious. I like to have fun. I joke around with my patients, and sometimes they don't think of me as a conventional dentist that they're used to going to see, but I want them to feel comfortable. I want them to know who I am. There's no reason. I like to make my job fun. And so when they come and see me, we try to, have a
little fun.
Have a little bit of, yeah, exactly.
Good for you. Okay, we're out of time. And if somebody wants to learn more, they go to your website. They can, do you still, will they see the consult with you? They get to see you?
Yes, absolutely. Okay, and I'm the guy that does everything. You're gonna see me for the procedure from the start to finish and everything in between.
All right, Dr. Amedy, I want to thank you for coming on the show.
Thank
Good
you,
stuff.
Randy. I appreciate it.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Araz. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.